into a continuation from what we were learning with behavior and social inequality. So just like a quick recap, if we show that continuation from first having this prejudice, first having like cognition or how you think of other people and perception, and then having a prejudice, so you have this emotional aspect, and now we're kind of into the behavior aspect, which is now behavior and social inequality. And so the behavior aspect is discrimination, which is the differential treatment and harmful actions against minorities or by sex, race, age, religion, etc., all these different aspects. And discrimination can not only happen individually, which is an individual acting to discriminate others, but also institutionally, which is when organizations, so governments, banks, others, discriminate others by rules that are set in place for these different organizations. So an example would have been like Brown versus Board of Education, where there was the segregation rules in schools at that time. There's also unintentional discrimination, which is how policies can discriminate unintentionally. They may not know it initially, but that's just how sometimes some policies are. And there's also side effect discrimination, which is how one institution in all these different fields can influence another field negatively because they're all somehow interrelated. So with like, we could do like politics and law and kind of going over, you know, how certain laws are associated with factors that politicians may say. And so, you know, there could be something associated with that. And then there's also past and present discrimination, which is how things done in the past have consequences for people also in the present. So an example was even after the Brown versus Board of Education had been, you know, overturned so that schools were able to allow all races to go to an individual to each of these schools. It's still because of that past discrimination that was kind of instilled in that institution. Even after they were allowed, it tended to be that integrated students didn't feel quite welcome in those new schools because of how long it's been that they weren't allowed in the school. And then also now we kind of go into social inequality, which are the resources, which is the idea that resources in a society are unevenly distributed. So these are just some like statistics, which in the US, the top 20% of the socioeconomic status have 72% of the wealth of the country, and the bottom 20% only control 3%. And this is just also a thing that you guys should know for that section is as you go up the social ladder, it tends to be that you have better access to education, healthcare, and housing. So all of these good things associated with a higher socioeconomic status. And then also globally, there is global, you know, inequality as well, where an example, some statistics, life expectancy in Congo is 51 versus France or Japan, which is 84. This may have changed over some time, but this was like one in the past. And then also, you know, there are differences in clean water, mortality rate, etc., between all these different countries. So then we also have groups of populations that tend to be disproportionately affected and so here we have ethnic racial minorities and those in poverty tend to have lower incomes, lower education, and reduced access to healthcare. And so, you know, we see this inequality between different groups here And just also some terms to know. So there is absolute poverty, which is the absolute level at which you go below. And if you go below that level, survival of an individual is threatened. So that severe of poverty versus relative poverty, which is more just a low income in one society that excludes them from maybe some of the benefits of society, but it's not threatening their survival in particular. And then also, with other groups that are disproportionately affected, and having this inequality is an example with females that experience differences in the gender pay gap, and also the glass ceiling effect, which is, when they're not quite able to rise up in their positions and hold leadership, like large leadership positions in businesses, because there is this kind of barrier for women. And kind of ways to help that society has kind of come up with so far has been government schemes, so like food stamps and other resources to help these individuals that are disproportionately affected. Also trying to improve their access to education and healthcare, and also figuring out social interventions that would allow them to integrate better in society, which, yes. So then I also wanted to kind of go over methods that kind of sustain or maintain the social inequality, which could be from underlying factors and other terms as well. So social reproduction is the perpetuation of inequality through social institutions, such as through like education or economy across different generations, and just causing this to continue. And so some ways that this is kind of continued could be through like social capital. So social networks tends to be that higher those with higher socioeconomic statuses tend to have like wider, better social networks compared to maybe ones that don't have or are in that poverty area. And then also there's cultural capital that people can differ in, which is the understanding of other cultures, because understanding other cultures tends to also help them get a leg up in terms of like networking and understanding other individuals, connecting with them. It might help them in terms of like business opportunities or, working with other companies. And then there's also social stratification, which is the society's categorization of people in socioeconomic strata, which I guess, well, not I guess, but when you're in that lower strata, it's a lot harder to get out and move up in terms of that strata to a higher area, in which, like, because you're at that higher level already, you have all those resources to kind of sustain your position in society. And then speaking of moving from one strata to another, that is the term social mobility, which is the movement of individuals, social groups, or categories of people between layers or strata in the system. And this is like the opposition of social reproduction, when you're able to move up in your stratification system. And there is also a difference in like vertical social mobility. So that would be like moving up into like those more wealthier levels, versus like horizontal mobility, which is you may be moving to like a different occupation level, but it would be still within that same kind of strata. Yes. And then social exclusion is another method that maintains social inequality, because it causes people to be kind of dragged into the periphery of society, and then it doesn't give them as much access to resources or opportunities that would help them get out of certain situations like that. And could be because of poverty, ill health, discrimination, segregation. These are all factors that cause different people to be excluded from society. And then there's also the aspect of environmental justice that maintains social inequality, which is the fair distribution of the environmental benefits and burdens within society across all groups. So, like with areas with high poverty and lots of racial minorities, many of them have few environmental benefits, as in like green spaces, parks, and recreations to help with, like, one aspect could be health, getting the opportunity to walk around and exercise and maintain your health. These areas with high poverty instead have large environmental burden with a lot of waste and pollution, which ends up making their health not as great because of the factors that they're experiencing in their community, as opposed to wealthier groups that probably have all these environmental benefits. So, yeah. And then I wanted to end with health and healthcare disparities. So, like I was just mentioning with, all these different factors that can maintain social inequality, and how these can affect health. So, with a term social epidemiology, which looks at health disparities through social indicators like race, gender, and income distribution, and also how social factors affect a person's health. So this focuses on the contribution of social and cultural factors to disease patterns in populations, which are the social, also known as the social determinants of a disease. So as time has been going on, because of how people may be grouped in different categories, researchers have been finding that there are a lot of social factors that influence how their health outcomes are. And so social epidemiology is within epidemiology, like the larger branch, which is just, it deals with incidence, distribution, and possible control of diseases and other factors relating to health. And it has a significant overlap with the sociological perspective on health and disease. And so that's also with looking at how social factors influence, health and disease. And I mentioned healthcare disparities, so I'm just gonna make sure there is health disparity, which is the difference in health outcome that is closely related to social and economic factors, not by biological factors, which tend to be due to, as I kind of mentioned earlier, with poor environmental conditions, but on top of that, poor economic conditions, versus healthcare disparities, which is the differences in access to or the availability of medical facilities and services, and variation in rates of disease occurrence and disabilities in different groups. So we have that slight difference between health disparity and healthcare disparities. And so these are just some points to know about healthcare disparities that has kind of been assumed on the MCAT that students would know. So one is that the quality of healthcare improves as you go up the social pyramid. And then also it tends to be that Hispanics and African Americans have higher morbidity and mortality rates because they have worse access to healthcare and also lower quality healthcare. And then also that men typically use fewer preventative services like vaccines or checkups, and so they don't go to the doctor as much as maybe women because they require reproductive services, and also, but at the same time, their access is reduced due to local laws because I guess they tend to, sometimes they know that and they decide to do a law like that, which I guess that's just something to know. Also, that studies for treatments for diabetes or heart disease don't always include women. So just sometimes they don't account for every single group or every group in the population. And then also that the LGBT community might face discrimination, which ends up limiting their clinics that they feel comfortable seeking help with, which then leads to them not quite going to as many healthcare facilities for help if they are to become ill.